New York Times, Somini Sengupta. She is going to speak. Her talk is called ISIS, Ebola, and Bodies That Fell from the Sky, a View of the Global Crisis from the United Nations. She is the United Nations Bureau Chief for the New York Times, so with no further ado, I will turn the time over to Somini. Come on.
Thank you so much, everybody, for coming. I'm going to start off by telling you a story of a July morning, very far from here, in a country created by freed American slaves called Liberia. It was early in the morning, the coolest part of the day, and I was in the backseat of a Jeep. Those two words could feel good about itself. Then came December 6th, 2013. A toddler died in a village across the border from that hospital that I told you about, in the forest region of Guinea. His mother died next, then his 3-year-old sister, and his grandmother, and then health workers got infected, and they carried it back to their villages and infected others. No one knew, for months, no one knew what to call this disease. Everyone was terrified of it. There was fever, vomiting, diarrhea, and a quick, undignified death. Only in March of this year, March 2014, did doctors name it. And you all know what it's called now, Ebola. Soon, a traditional healer came down with the disease, and the mourners who came to her funeral spread it to 78 people in the region. One of the doctors who uncovered this trail, he was a leading infectious diseases specialist in Sierra Leone, he died at the end of July. That's also when a Liberian man got on a plane and took it to Nigeria. 2 American missionaries in Liberia fell ill, and all over Guinea, Liberia, and Sierra Leone, the 3 hardest hit countries, the health system was so unprepared that the few clinics that were treating Ebola had to turn away the sick. There were bodies lying in the streets. At one point, the gravediggers went on strike. As I speak to you now, there are more than 13,000 recorded cases of Ebola. That's from the World Health Organization briefing just this morning in Geneva. 5,000 people are dead in Guinea, Liberia, and Sierra Leone, and those numbers could well be a fraction of the real problem. This is a moment of reckoning for the international community, and particularly for the United Nations, because if not on something as deadly as this, then what is it good for? And if not now, when the UN is 69 years old, then when? So Ebola has served to really pull down the curtain. It showed how unprepared the world was. The World Health Organization was very, very slow in recognizing the intensity of the disease and doing something about it. The international pharmaceutical industry didn't bother to develop a vaccine. There simply wasn't money to be made in it. Donors poured in a good deal of money into rebuilding the war-torn countries of West Africa, but apparently not enough to build a functioning healthcare system that could deal with something like this. 5,000 UN peacekeepers were on the ground in Liberia when Ebola was identified in March. But they didn't build the treatment centers that were desperately needed over the summer. In August, finally, the World Health Organization declared Ebola in West Africa to be an international public health emergency. And in the corridors of the United Nations, it became very quickly apparent that Ebola could well add to a list of crises that the international community had failed to halt. The list is long already, as many of you will know, from failure to stop the 1995 genocide in Rwanda to a cholera outbreak in Haiti that UN peacekeepers were accused of bringing. So this summer, starting really in August, the UN chief Ban Ki-moon pressed presidents and prime ministers all over the world to rally in support of the Ebola-affected countries. Money, helicopters, nurses, doctors, they needed everything. And indeed, it soon became our problem, not just their problem. I say this knowing full well that what happens out there in the world can bear so directly on our immediate community. Equally, why the international community, that vague, hopeful slogan, can matter.